Hey there, I'm Sarah Clark, founder of Fab Fertile, and today I wanted to walk you through a case study with someone who has premature ovarian insufficiency or failure. So she's 36 years old. She has premature ovarian insufficiency or failure, high FSH, low AMH, and she actually has secondary infertility. Her IVF was canceled because she's a poor responder, and her menstrual cycle has been irregular. Ovulation, she's not sure if she's ovulating. She has a history, which is a theme we see with the couples we work with, of long-term hormonal birth control use. And some of her symptoms here, she had asthma, migraines, insomnia, sinus congestion, eczema, and anxiety. She also has poor digestion. She alternated between constipation and diarrhea and chronic stress. So she had a very high stress job, and the fertility journey in itself for her was very triggering, which is very common with the couples we work with. And as you know, we work with couples. So for the male partner, he had elevated glucose levels, which is quite a theme that we see with the couples we work with, which then can impact the sex hormones. He was also in a stressful job, and he did not have great sleep. Basically, with our Fab Fertile method, we review the health history. We do customized functional testing. We have access to functional testing. We do blood chemistry review, not to diagnose, but to educate. And we're looking at the blood chemistry and functional testing through functional reference ranges. They're just tighter reference ranges, and it flags it earlier before it goes to disease. So we found out for her, this is a theme we see all the time with POI and POF, is non-gluten sensitivity. So for her, gluten was off the chart. And she was also reacting for food sensitivities with many of these cross reactors to gluten. So the body then identifies these other foods as gluten and mounts an immune response. So for her, it was eggs. She was also intolerant to yeast, which was the same for me, where I had all these toenail infections and yeast infections for years. So for me, yeast was on my food sensitivity test as well. So fungal overgrowth. She was sensitive to whey, also nuts, and some more foods as well. We did the elimination diet for both her and her partner, and then we tweak it further with food sensitivity tests. So her hormones, we balanced her hormones. She had estrogen dominance, which sometimes you think with premature ovarian insufficiency or failure is that they would have low estrogen, but then really is it going down the right pathways, and what is happening with your hormones? So we can look at that through blood and through urine. Again, we have access to these tests. She had low melatonin, which many times for IVF, you may have been told to supplement with melatonin, which then can impair your body's ability to make its own melatonin. And first of all, well, why is your melatonin low to begin with, which could be a sign of gut infections or gut bugs. And then she also had thyroid imbalance. We see this all the time. It's like, I don't know, 99%, 100% of people we work with, there's something going on in the thyroid. So she had thyroid imbalance. So it wasn't that she had hypothyroidism, so subclinical thyroid issues, so issues going on with her gut and her liver. So again, we don't diagnose, we educate. So if there's issues with medication that needed to be taken and along with the diet and lifestyle changes, she would consult her physician. In this case, she didn't need medication. Did the gut testing, found out she had streptococcus, other parasites. So that's a bacteria. She had other parasites. She had low immune system. And even though prior to this, she was gluten-free prior to this, but we found out that she had high anti-gliadin. So she was still getting exposed to gluten, even though she'd gone that nice gluten-free diet that was right for her body. She was still being exposed, and it might have been some of those cross reactors that she was regularly eating. The mental emotional stress for her, and like many of the couples we work with, was really high. Even seeing families, seeing pregnant bellies, all of this, the thing that you want most in life is really all around you. So it can be extremely triggering. So working with her to be able to visualize it working with her on her like worry, the impatient side of this, where the fertility industry in itself can breed impatience. And if you're like me, like I've been impatient my whole life, and many of the couples we work with, this just even makes the impatience worse. So being able to work with that for her. And then with her partner, we optimized his blood sugar. He was able to set boundaries. He improved his sleep. And then within 7 months into the Fab Fertile program, she was pregnant naturally. This is after being told that donor eggs are her only option. You know, she went into the clinic actually to do prepare for a retrieval, and they found out she was pregnant. So if this approach feels right for you, our Fab Fertile method, you can click on a link and book a call with us, and we can see if this approach is a good fit for you and you are a good fit for our program. So thanks again and take care.